Hi, I'm Dr. Jeff Nickel, and I have our family border collie, Miss America, here. And this is Tony, and this is Gaston. And we're here to talk about dogs who wet their pants. Yeah, it's not that funny if it's your dog. But these pets are really freaked out, and they're generally the sweetest dogs you can imagine, but they lose control of themselves. Now, I'm residency trained in veterinary behavior medicine. I've been practicing general medicine as well for many, many years. And this is a problem that can be confused with physical issues in some cases. And so we need to parse apart those details. Now, if you have a question, anything comes up, by all means you can interrupt me. And if you like what you're seeing, hit the wow or the heart button. I'm always happy to see people tell me what they like. I'm just trying to share information, and I want to make sure it's helpful. Now, there was no Facebook Live last week. I was in the great city of Baltimore. I'd never been there. It was a pretty cool place. I went to speak at a veterinary convention there, and my presentation to general practitioners had to do with differentiating symptoms of urine soiling that were due to behavior problems, and we explained several of them and how to treat them, and also how they could determine whether it was a physical problem that needed x-rays, urine culture, those kinds of things. And so it's important to know the difference, and that was what I was sharing with many general practitioners. So this is a big problem. It turns out that 20% of pets in American households urine soil. So if you see that at home, you're not alone, and it's a huge problem in cats and dogs. So what I want to do is just point out that, we all want simple solutions, and the reality is, well, there aren't any. Okay, but bear with me. I'm going to make this as easy for everybody as possible. So when we look at a problem that we don't want, of course, the first impulse is to try to teach the pet, stop doing that, okay? And this can be especially frustrating with pets who are, leaking urine or dribbling urine when they get kind of freaked out. Well, that's what happens when people come home and you've got one of these low-ranking, submissive dogs who actually does it sort of naturally. And it's really important to realize that these dogs cannot help it. There isn't anything they know how to do about it. And so if you are going to try to correct the behavior, tell the dog, no, we don't want that, haul the dog outside, and honestly, people have yelled at these dogs, they've punished them physically in some cases, and you take a dog who starts out as nervous and overwhelmed, and you add a major helping of anxiety, and these pets can get a lot worse. So instead, what we're going to do is we're going to share our empathy with them, and we're going to set them up for success. Okay? So, the truth is, this is the kind of thing where, it's actually pretty predictable. If you come home from work and you walk in the door and your dog just gets so excited because she's delighted to see you and rolls over on her side, raises one rear leg, something like that, if that looks familiar to you, and lets go of their bladder, and maybe she'll wag her tail in it and make an even bigger mess. It's pretty frustrating. And these are dogs who, what we need to do is to set them up to associate something very different with hearing their leader show up near the house. Okay? So, frankly, anxiety can play a big part in this thing. Some dogs are genetically anxious. But on the other hand, again, for many of these low-status dogs, it's sort of normal for them. In fact, it's normal for dogs anyway when they're infants. These neonatal puppies, within the first couple of weeks of life, it is completely normal for their mother to approach the group of puppies, to lean over them, and to lick their rear ends to stimulate them to urinate and defecate, and she cleans up after them. And so it is totally normal for them to eliminate when they get approached by their leader and who leans over them. So you can see that if you have an adult dog who's sort of stuck in that neurologic pattern, the dog just does it because that's what she does. Well, of course, most dogs outgrow this, but to those who don't, what we're going to do is help them through this thing. So, again, as soon as you notice any problem at all with urine behaviors, be sure to go to your regular veterinarian and ask the doctor to rule out the physical stuff. One of the most common ones is called ectopic ureters. This is a problem where the tube leading urine from the kidneys should be carrying it and depositing it into the bladder. Well, if it's an ectopic ureter, that little tube instead plugs into the bladder, plugs into the outflow, either the vagina or the urethra in the male. And these dogs don't have the physical control. This is actually not a behavior disorder, but a birth defect, and it is surgically correctable. So you don't need to live with those, and that needs to be ruled out. But so do bladder stones and bladder infections. So let's make sure that we don't have any issues that are, need medication of a physical sort. I'm going to start by telling you a story about a dog named Jack. And here she is. She's a female, and she's a real delightful girl. I mean, her folks just loved her. Well, she had a special affection for her daddy, and when he came home from work, like so many people, the dog is delighted to see her people, and the people are delighted to see their dog. Well, they can make a big fuss about each other, and that seemed like it was a very big factor in triggering Jack to lose control of her urine. Well, let's go back for just a minute to what dogs are actually programmed to do socially in their canine social group, that is, how they function in a group in the wild. And that is that when the leader of the group leaves the territory to go off and sniff and investigate and explore and read the bulletin boards and post messages of her own or his own, when the leader leaves, it is a non-event for the lower status dogs. And in fact, when the leader returns, the lower status dogs, it's also a non-event. Nobody gets a hug and a kiss and drive safely and be careful and all that human stuff that we do. Dogs don't do that. So instead, if you have a dog who gets kind of exuberant and out of control and maybe loses control of his or her bladder when you return, or makes a big fuss when you're leaving, by responding at all, you may be setting your dog up for a problem. And so what you really ought to be doing is trying to show your dog canine-specific leadership. In other words, do what the dog who would be the leader of the group, if your boy or girl dog were living in the wild, what would its leader be doing? And that is that you can share all the affection you want with your dog and have a wonderful time, but none of that really should be associated with leaving home or getting back. And that's actually setting a dog up for success, because the dog looks at that and goes, I see what my leader's doing. That's canine leadership. I get it. Okay? So start by ignoring as you leave home and return. So here's the story of Jack the girl dog. And when shortly after her folks got her, she was about a year old when they adopted her from the shelter. And when they first brought her home, of course, she needed to go see the veterinarian to get her vaccinations and her first exam. And when they took her in, the doctor came into the exam room, and Jack freaked out so much that she hid behind her person and tried to climb up her pet mother's back. I mean, she was just freaked out. Poor thing. I mean, she's a scared dog, on top of having a genetic tendency for just not having good bladder control. So, what are we going to do with this? What we need to do is avoid the arousal trigger. All right, Ms. America? So what, again, I told these folks to do immediately was, no longer is there any such thing as a DOG when you walk in. You are two folks who live in a house, and you're the only two creatures with a pulse, and there is no such thing as a dog. You have to become world-class ignorers. So when that dog, Jack, looked at her people, she'd say, oh, there's no response coming from these folks, so clearly they're not going to trigger any more of my arousal. As the old saying goes, if you find yourself in a hole, the first thing to do is stop digging, right? Okay, so I made sure that they understood that there was no way that Jack could help it. It was just a reaction that she had. So after they came in the house and had done a great job of ignoring, they were such good ignorers, they weren't ignoring anybody. That's how good they were. And that's really important, because dogs watch our body signaling exceptionally carefully, and they miss nothing, even the subtlest of our body language. So you have to not only have none, be sure that every one of the 100 billion active neurons in your brain is engaged in something else, so that when your dog looks at you, well, you don't have a dog, because that's how good you are at ignoring. All right, so you walk in the house, and you go about your business. And maybe several seconds or a minute or two later, it's an individual thing with everybody, you steal a quick glance. And if you notice a dog who's calmer, you want to reinforce that. That has earned an interaction with the leader. And so the best thing to do is to squat down with your side turned towards your dog, and don't look at her directly. Look at her through your peripheral vision. You can see her, but you're not looking directly at her. And the reason is that your dog, no matter how much she loves you and trusts you, and the strength of your bond, can still feel that stab of panic, that overwhelm. And you think, how could that be? I've never done anything but give this dog the kindest, loving attention. It's not about you. It's about your dog's problem. So to set her up for success, or him in some cases, you squat. You don't approach your dog. You don't lean over your dog, and you don't, no eyeball to eyeball, okay? At least not at those times, because your dog is ramped down somewhat, but not entirely. So you can squat and then look next to your dog, and you can extend your hand and allow your dog to come near you. And then if your dog knows simple obedience commands like sit her down, you can very quietly but clearly say, Miss America, down, and she lays down, and then you say, good girl, very quietly. You know how you teach a dog to come when called? You get exuberant on the dog, with the dog on her way into you, because you want your dog to come when called with enthusiasm. And that's completely appropriate in that context. But in the context of you getting home, everything should be quiet and relaxed and low-key. So when your dog's arousal level diminishes and you say, this is starting to look better, when you reinforce that, it needs to be, good girl, very, very quiet. So I explained to Jack's folks, this is the way it needs to go. And they did exactly as I instructed them. And Jack was much better. She felt so much better that she was quieter and more relaxed when her folks walked in. They reinforced her for ramping down her arousal, and the problem improved, but it still happened. So there are medications for that. Now here's one of them, and it is called Proin, and I'm going to turn this camera around so you can see it. And it is a chewable tablet by a company called PRN Pharmacal. Your veterinarian has it on the shelf. I can promise you that. It is typically used for dogs who, female dogs have been spayed, who because of a lower estrogen level, they tend to dribble while they're sleeping. Now this is a different problem, but the Proin will work for that as well. Now, with a dog who's already got an anxiety problem, and Jack did, she had some other anxiety-related symptoms. I won't bore you with all those details right now, but this medication can sometimes cause a problem if the dog's already got anxiety. So instead, I prescribed a different medication, and I don't have it to show you. It's called imipramine, I-M-I-P-R-A-M-I-N-E. Imipramine is an anti-anxiety with a side effect that we like very much for these dogs, and that is that it causes moderate urine retention. So by giving Jack imipramine, we were able to diminish some of the anxiety component in this problem in her case and add to her urine retention. Not completely, but enough so that she had better control. And that made a very big difference. Now you think, gee, you know, I'm busy. I don't have time for all this stuff. Do I really have to do it? Well, I've got a simpler solution for you in this case. Number one, make sure you don't trigger any kind of arousal when you arrive and leave home. Just ignore it those times. That's easy to do. And then, if you want to, you can use a diaper. Now this is something called, it's a brand called Pet Parents, which I always thought was a rather odd name, because why would a pet parent wear a dog diaper? I don't know. But anyway, it's got a little Velcro here, got a little place for the dog's tail, and you bring it up around the female dog's abdomen, and then you Velcro it on there. And what's nice about these things is that you can throw them in the laundry. And so if you do this, well, you sort of don't have a problem, and it's completely okay. You don't have to use behavior modification, counter-conditioning. That's what I just explained with squatting and giving your dog a command, which we call a counter-command. In other words, what you've done when you teach your dog that is that now, if every single night when you come home, you ignore as you come in, and then you give your dog something else to do, a response substitution. She learns to anticipate that when you walk in, she'll have an opportunity to earn an interaction when she's calm. And of course, that opportunity is to follow a simple command like sit her down. Well, if you don't have time for that stuff, just go ahead and use the diaper. Nothing wrong with that at all. The most important part of all of this is to avoid the arousal trigger, which is your excitement when you walk in. I think you can do this. You know, it really comes down largely to empathy. And when I have a pet parent come in and, you know, they're quite frustrated, and I get that. I mean, who wants urine in their house? And, you know, many people are perfectly honest. And my job is not to judge, make mistakes. And they make mistakes because nobody's taught them any different. They don't understand the problem to begin with. And so I explain that when you're empathic toward a dog or a cat, just as you would be toward a person who had a challenge, a handicap of some kind, when you show empathy, you set them up for success. And so when you bring out the best in others, and you wait until the dog is capable of doing as it's told, and earning that response from you, and you tell her she's good, you not only bring out her best and make it possible for her to succeed, but you know, when you tell somebody else they're doing something really good, it really does something special for us too, doesn't it? It changes our attitude. You know, if you come home and you're a little cranky and grumpy about something that happened, and then you immediately shift your mindset to telling your dog, you've done the right thing. Wow, you know, that's good for everybody. And so, you know, our pets, even their behavior issues can bring out our best. And that's just part of the reason that I can't imagine life without them. So thanks for watching, and I hope this was helpful for if you have a dog who wets her pants or wets his pants. And so any questions? Anybody have anything? And it doesn't have to be about dogs who lose control of themselves and embarrass everybody when you walk in the door. It can be about anything, canine or feline. I'm happy to address it. Or if you come upon this Facebook Live later and you'd like to type a question in, by all means do it, and I'll get to it within a couple of days. I'm pretty good about answering those things. And you know, one last thing. If you want to get these Facebook Lives on Tuesday mornings, along with my weekly, what we call media, which is my question and answer newspaper column I write in the Albuquerque Journal, by all means go to my website, drjeffnichol.com, drjeff, Nichol, and you can subscribe at no cost, of course. And when you do, you'll get my at-home pet first aid and CPR guide, which really can be a lifesaver. Or, you know, you can put questions in there. You can search the website. There's a great deal you can find now. I think I have a question here, and that is from Cindy. Hi, Cindy. Well, you're welcome, and thank you. Now, Cindy, you know, you do something that is exactly what I was just saying people can do with their pets, and that is, you know, she's done this before. She tells me I've done a good job. And, you know, that's all I'm trying to do is be helpful, and thank you, because I feel better, and you've just inspired me to stay after it, which is what I'm going to plan to do. And these, we've got flying treats here and roaming cats, and Miss America just sort of minding her own business. So thanks, everybody, and have a wonderful week, and we'll be back on Thursday of next week. Oh, I have some hearts. Thank you for that.